Hi, this is Dr. Thomas Moshiri with Arizona Pain. I'm an interventional pain and spine physician, and I'm here to answer some of the commonly asked questions about some of the procedures that we do and some of the services that we offer. Who is a good candidate for an epidural steroid injection? Epidural steroid injection is a procedure that we do for patients that have either nerve root impingement in their back, or they have disc herniations, they have pain going down their legs. And for those kind of patients, an epidural steroid injection is very helpful. It reduces the inflammation around the nerves and around the disc, and it brings significant pain relief. Okay, so what are the benefits of an epidural steroid injection as compared to other procedures or other injections like it? An epidural steroid injection is a procedure that reduces the inflammation around nerve roots and around the disc in the spine. There really isn't any other procedure like it that will produce the same result. So it's really something that's very unique for patients that have nerve pain or disc-related pain in their spine or around their spinal cord, and it reduces pain significantly. So how is an epidural steroid injection performed, and is it considered minimally invasive? An epidural steroid injection is performed by having a patient lay on their belly on a table with using X-ray and localizing exactly where we're going to do a procedure. Everything is done visually so we can see using fluoroscopy where the bones are and what the anatomy is like. We essentially clean up the skin, numb it up, and put a needle through the numbed area. That needle goes into the epidural space just like you would experience, if you're giving birth and having a labor epidural. So it goes into the epidural space, and then we inject medicine there, take the needle out, and that's it. Pretty quick and easy. We can typically do it in a very short period of time. So what are the potential risks and side effects of an epidural steroid injection? Well, just like with any other procedure that you do, the main risks are infection, bleeding, and nerve damage. Those are the main things. Of course, we minimize all of those risks because we sterilize the skin before we start working, and we're working under fluoroscopy so we can visualize everything that we're doing, and it's a very precise procedure. So really the risk of bleeding, nerve damage, and infection is minimized by those parameters. In the 20 years that I've been doing this, I've never had anyone have an infection or nerve damage from an epidural steroid injection. So what is the success rate of an epidural steroid injection? Well, a lot of that depends on your anatomy and what the underlying cause is. I've had patients that have 100% relief from an epidural steroid injection, and I've had patients that have had 20 to 30% relief from an epidural steroid injection. So a lot of that depends on what is bringing you through the doors. I think the best person that can answer that question for you is the provider whom you're consulting with, and they can really get down to what your specific issue is and can answer those questions for you. How do epidural steroid injections improve quality of life? It's very simple. If we can reduce your pain and we can help you regain function and strength in your lower extremity, or even in your upper extremity, because we do epidural injections, epidural steroid injections up in the neck area or in the thoracic area for arm or thoracic pain. In any event, anytime that you perform a procedure that provides pain relief, allows patients to be more active and regain the function that they've lost, and that improves your quality of life significantly. So are there any lifestyle changes or follow-up care needed after undergoing an epidural steroid injection? Honestly, not anything that would be any different from what you're typically used to. So after the procedure, I usually tell all my patients it usually takes anywhere from 3 to 7 days for that medicine to start taking effect and for you to notice the difference. So the difference is not immediate. It does take some time. So as far as the follow-up, we typically follow up with patients anywhere from 1 to 2 weeks out after the procedure to see how they did and if they had good relief of symptoms and if we need to repeat the procedure. But besides that, there's really no lifestyle changes that need to happen. If anything, when patients improve, they naturally have an improvement in their lifestyle and they're more functional and can do more things. So it's really a positive change for most patients. So can epidural steroid injections be combined with other treatments for certain problems and painful symptoms? The short answer is yes, of course. You can do multiple things at the same time. Realistically though, if you're coming in for a specific problem And if we do too many things at the same time, then we won't know which one is the thing that actually helped and worked. So typically we'll address one problem at a time as we're moving forward. If it's, let's say, neck pain and back pain, typically we'll address the worst first, and then we'll address the secondary problem second, just so that we can determine which one of the treatment algorithms, which one of the treatment plans is working for that specific patient. Let me share with you an example of a patient that had a very successful epidural steroid injection. I have a patient that would come and see me on a regular basis, and she had significant neck pain. And what I would do is I would evaluate her and perform an epidural steroid injection. This patient tended to do significantly well. She was very active, and every time that we did an epidural steroid injection for her, she was essentially good to go for about 5 to 6 months. And so I would really only see her about twice a year, and she would just come in, get her epidural steroid injection, and she'd be gone and active. And she was the kind of person that would swim a couple of miles every day. And she was in her 60s, so she was a pretty unique patient. But in my practice, I've seen a lot of patients that significantly benefit from an epidural steroid injection. It really allows for them to get into a period of recovery that allows for them to do physical therapy, rehab, regain functional strength, regain mobility, that then allows for them to have better satisfaction and better quality of life as they move on and go forward.